This is our first part of our special considerations section. Most of the time, there are reasons behind people's actions. It is best to never judge or assume with anyone. Everyone's story is different. Let's start with knowing what exactly depression is. It is a persistent feeling of sadness and loss of interest for daily activities and events. Depression affects how you feel, how you think, and how you behave. Depression interferes with daily life. People often feel life isn't worth living. Depression isn't always just in someone's head, but can actually cause physical symptoms as well. So how do we know if a person is depressed? To have a true diagnosis, a person would have to see a mental health professional. But if you think you or someone you know might be suffering from depression, these are a few signs to look for. Sadness and unhappiness. If the person seems to be irritable or easily frustrated, even over small matters. If the person has a loss of interest of pleasure in normal activities. Depression can cause insomnia or more commonly an excessive amount of sleeping. Changes in appetite might be a sign of depression. This could be eating too much or eating too little. They may be very agitated or restless. They may have problems with decision making and could be easily distracted. They might have a hard time concentrating on small or large tasks or conversations. They can become overwhelmed with crying spells, have serious fatigue or loss of energy, or other unexplainable physical issues. And the most serious symptoms of depression is frequent thoughts of death, dying, and even suicide. Symptoms can be very similar with children and with teens, but they can also be very different. They would feel sadness and hopelessness like adults do. A lack of energy, lack of motivation are also very similar. A decrease of performance in school and schoolwork can be symptoms of depression for children and teens. They may be very worried, anxious, or angry. They may be withdrawn or have major changes in sleep and in their eating habits. Just like adults, children can have recurring thoughts of death, dying, or suicide. Depression can be a very serious psychological disorder with children. So what causes depression? It can really be a combination of factors that include genetics, chemical imbalances, psychological stressors, social stressors, and also can have a lot to do with the environment in a person's life. We will go over a list of events or things that may cause depression. Many cases of depression can be linked to significant transitions in life and major life stressors. This could include a death of a loved one, big financial problems, or a loss of a job. Depression can stem from early childhood trauma. Trauma could be anything from abuse, neglect, or even a loss of a parent. Some people have inherent traits. People have a higher risk of developing depression if a family member has suffered from depression as well. There can be many complications when it comes to depression. Untreated depression can result in emotional, behavioral, and physical health problems that affect every area of life. These things may include alcohol or other substances that are being abused, anxiety, problems at school or at work, big family conflicts, social isolation, and suicide. So how do we diagnose depression? People that are seeking help for depression can seek a physical exam, many laboratory tests, and also a psychological evaluation. Here is a list of other disorders and diagnoses that could be linked or could be very similar to depression. Adjustment disorder occurs when an individual is unable to adjust or to cope with a particular stressor, like a major life event. Bipolar disorder is a mental disorder characterized by periods of elevated mood and periods of depression. Cyclothymia is a type of chronic mood disorder widely considered to be a more chronic but milder or subthreshold form of bipolar disorder. Themia is a mood disorder consisting of the same cognitive and physical problems as in depression, with less severe but longer-lasting symptoms. Postpartum depression is a type of clinical depression which can affect women after childbirth. Seasonal affective disorder is a mood disorder subset in which people who have normal mental health throughout most of the year experience depressive symptoms in the winter or in the summer. So what steps can people take to start treatment for depression? We will first talk about screening tests and what they do. These tests improve accurate identification of the depressed patient. It does not produce a diagnosis. These tests can help identify a variety of symptoms. The benefits of these tests are that they are administered by a clinician. The person will receive a result from a professional, which is a lot more accurate than a self-rating or self-administered test. Some examples of these tests are a patient health questionnaire, the Hamilton Depression Rating Scale, and the Beck Depression Inventory. Though depression can be extremely hard and debilitating, there are a lot of treatment options for this disorder. It is highly treatable, but there are a lot of reasons people may not seek help. A lot of people do not seek help because they believe their symptoms to be viewed as a sign of weakness. And if a person really wants quality treatment, it does take a lot of time and patience to feel better. Studies have shown that a combination of modalities used to treat depression is the most effective way to combat the symptoms. We will go through the different methods now. The first major method used to treat depression is psychotherapy. This is a general term used for treating depression by talking about conditions and related issues with mental health providers. There are many different types of psychotherapy, and it is about finding what works best for you. Medication is also a very popular method used for treating depression. Medication can help reduce symptoms. There are many different medications that people can choose from. This includes SSRIs, SNRIs, atypical antidepressants, and tricyclic antidepressants. Like I mentioned earlier, studies show that treating depression is best when combining different methods. As studies show, that is the most effective when medications are combined with psychotherapy. Hospitalization would be the last resort. It is necessary when the person is in immediate danger of harming themselves or harming someone else. It is necessary when the person has attempted suicide or has serious suicidal ideation. There are some other non-traditional treatments available as well. Listed below are a few ways that people seek help on other levels. So if you are experiencing some signs of depression, what can you do to take care of yourself, and what kind of support is out there to help combat these feelings? The best thing to do when you're feeling depressed is to simplify life. The less stress you have, the better you will feel. Journaling can be a very powerful tool to use when feelings of depression or sadness seem to be overwhelming. Participating in social activities can help boost your mood. Healthy diet and daily exercise is important for all aspects of life, but exercising and eating right can lead to a boost of serotonin and can also help you sleep better. Structuring your time, planning out your day, and making commitments can help with the feelings of sadness and give you reasons to get out of bed in the morning. It is important not to make big decisions when you're feeling down. They might not be what you truly want. Education is a great tool to use when it comes to depression. Knowing how and why you might be feeling a certain way can help you understand your condition and can push you to either self-care or seek professional help. Alcohol and drugs can sometimes make depression spiral out of control. The temporary high or numbness that comes with substance abuse will only lead to a deeper feeling of sadness, low self-esteem, and little or no self-worth. Keep in mind the warning signs of depression with yourself and your friends and family. If you or someone you know suffers from depression, knowing what triggers these feelings can be a great way to try to avoid falling deeper into this disorder. And lastly, using these tools to help yourself or loved one get better and rebuild resilience to fight depression can be a life changer. So how do we build resilience to combat feelings of depression? We do this by making connections with people, resources, and our environment, avoid seeing crises as insurmountable problems, Accept that change is part of life. Move toward goals, making realistic and obtainable goals to help boost your mood and self-esteem. It is important to nurture a positive view of self and avoid negative thoughts. Keep things in perspective so you're not comparing yourself to unrealistic things. Maintaining hopeful outlook. Find positive ways to reduce stress and negative feelings. Now we are going to talk about the most dangerous and the negative side of depression and suicide. Suicide is a desperate attempt to escape suffering that has become unbearable. People that consider or attempt suicide cannot see any other way out of their suffering, and this might seem like the best way to relieve themselves of these horrible feelings. Most of the people do not actually want to die, but they want the hurting to stop. We are going to go over facts about suicide and statistics. The Center for Disease Control and Prevention collects data about mortality in the United States. In 2010, there were 38,364 suicides in the U.S., making suicide the 10th leading cause of death for Americans. That is a very big number of suicides, so depression and suicidal thoughts are very dangerous, and it is important to try to fight depression with everything that we have. Someone dies every 13.7 minutes in the United States by committing suicide. So who is the most at risk for suicide? Let's talk about suicide rates. People that are between the ages of 45 and 64 are the most at risk, followed by individuals over the age of 85. But it is the second most common cause of death in adolescents, and this is a very high statistic. Men are 4 times more likely to die by suicide than women, even though women attempt suicide 3 times more often. Why is this? Males tend to use a more lethal means to end their life. Firearms are the most common method of ending one's own life, and it is more common with men than with women. That is why men are more likely to die from suicide. The second most common method with men is hanging and poisoning with females. These are the 3 most lethal methods used. Not everyone that attempts suicide dies from it. With adults, 10 out of every 40 attempted suicides result in death. With youth, only 1 in every 25 attempts result in death. And it is important to remember that though adolescents may have more acts of self-harm, this is not considered a suicide attempt. So what puts a person at a greater risk than others? There are certain characteristics or conditions in a person's life that increase the chance that they might try to take their own life. Recognizing the risk factors and the warning signs of suicide could help save lives. What are the risk factors for suicide? Psychological disorders are the leading risk factor, and they include but are not limited to depression or bipolar disorder, borderline or antisocial personality disorders, and anxiety disorder. Alcohol and substance abuse, previous suicide attempts, family history of suicide, serious medical conditions, highly stressful life event, prolonged stress, exposure to another suicide, access to lethal methods such as firearms, social isolation and loneliness, history of trauma or abuse, poverty or homelessness, and problems with gambling. Now that we know some of the risk factors for suicide, let's take a look at what some of the warning signs are. Talking about it, directly or indirectly. Planning methods to harm oneself. Hopelessness. If someone is feeling trapped or needing to escape, they may feel like a burden to others. Losing interest in things, losing ability to experience pleasure with activities or interactions that used to bring them joy. Becoming withdrawn or isolating themselves. Having dramatic mood swings. They might experience changes in their personality. Becoming preoccupied with death. Making a will or giving away money or possessions. Saying goodbye to loved ones, and even a sudden sense of calm. So what should you do when you suspect someone might be at risk? If you are worried about someone, it is important to take it seriously. 50 to 75% of people who are suicidal tell someone first. Ask questions. This may prevent an attempt. Don't argue or try to talk them out of it. This method doesn't seem to work. Don't act shocked or say that suicide is wrong, because to them it might feel like the only thing that is right and the only thing that makes sense. Offer them hope, letting them know that they are not alone and that they can come out of this. Show concern and compassion. Let them know that you are there to listen and that you will be there for them. Encourage them to share their feelings. Encourage professional help. You can help them find a counselor and let them know that professional help can really make a difference. Though people may mention it or have some warning signs, it is good to assess the risk level. Asking these questions can be very helpful in assessing where they are at. Are you feeling so bad that you are thinking about suicide? Have you thought about how you would do it? This would be seeing if they had a plan. Do you have what you need? This may seem like a difficult question to ask, but knowing if they have the means to carry out their plan will let you know if they are in immediate danger. Have you thought about when you would do it? This would let you know if they had intent. By asking these questions, you will be able to find out if the person is serious and also give you an idea of how far along they are in this plan. These are a few common misconceptions about suicide. Number 1, false. People who talk about suicide won't really do it. Number 2, false. Anyone who tries to kill himself or herself must be crazy. Number 3, false. If a person is determined to kill himself or herself, nothing can be done to stop them. Number 4, false. People who commit suicide are people who are unwilling to seek help. Number 5, false. Talking about suicide may give someone the idea. So what are some resources we have to help people that might be at risk? Take a minute to look over what we have nationally and in this area to help people with this. These resources are also available in our handouts and on our cheat sheet packets.